Next, let's move on to suggestions that might be new to some of you. Have you ever woken up in the middle of the night, checked the time, and felt horrified at how little time you have left to sleep? Or have you ever laid awake in bed, looking at the time go by and mentally calculating how much time you have left to sleep? This probably did not help you sleep better. Watching the clock before falling asleep or seeing it when you wake up during the night increases anxiety and makes you stay awake longer. So I propose not watching the clock once you get into bed. Even if you need to set an alarm, put the clock or the phone out of reach and out of sight, but within earshot. Avoid raising your body temperature close to bedtime. As we discussed earlier, your body temperature follows a circadian rhythm that is very similar to your sleep rhythm. You feel sleepiest when your body temperature is lowest, and you feel most awake when your body temperature is highest. If you like to take a bath or a shower in the evening, don't make the water very hot. Make sure the clothing you wear to bed is not making you hot, and the temperature in the room itself is comfortable. A larger theme here is my next suggestion. Do your best to create a safe and comfortable sleep environment. Your room at night should be dark and quiet, temperature cool but not cold. If you like to have white noise at night, it is okay to have a sound machine or a fan. Avoid having TV or radio on at night, since the noise from TV and radio is often irregular and likely to wake you up at night. If it is hard to control the amount of light in your room at night, consider wearing a sleep mask to keep the light out. If you've experienced trauma and don't feel safe when falling asleep, discuss this with your therapist. Wind down time is important in order to give your body time to gradually settle down. Your mind and body cannot just shut off from the day right at bedtime. It takes some time for the activation to come down, and attempting to go to sleep before winding down is likely to backfire. So give yourself at least an hour before going to bed. You can use that time to perform your bedtime routine, read, or do some other relaxing activity, and I will talk more about this in a while. Lastly, let's talk about medication and sleep supplements. Prescription sleep medication may offer a solution in the cases of acute insomnia when taken for a limited amount of time. However, sleep medications stop being effective after about 3 months of use. People do, however, develop a psychological dependence on sleep medications and cannot sleep if they don't take them. The same thing happens with sleep supplements. Most of them do not give you any more sleep time, but you are likely to become psychologically dependent on them.